This episode brought to you by Progressive Insurance. Do you ever find yourself playing the budgeting game? Shifting a little money here, a little there, and hoping it all works out? Well, with the Name Your Price tool from Progressive, you can get a better budgeter and potentially lower your insurance bill too. You tell Progressive what you want to pay for car insurance, and they'll help find you options within your budget. Try it today at Progressive.com. Progressive Casualty Insurance Company and Affiliates. Price and coverage match limited by state law. Not available in all states.
What is going on? You are listening to Tag's podcast, aka Talk About Gay Sex Podcast. I am your host, Stevie V. This is episode 666. And on this special episode, I am talking to the good doctor, the ass doctor, the proctologist himself, Dr. Goldstein, author of the book, But Seriously. Such a good interview. We love it when Dr. Goldstein is on the show, and he is going to be focusing on his other product line of Future Method. All these great things like the anal douche kit, his brand new lubricant, and so many other products that you can get right now, but also really deep dive into our asses and taking care of them for the long haul. Well, without further ado, let's just get into this conversation. I loved talking to him, as I always do, Dr. Goldstein. Well, I'm very excited today on Tag's podcast to be here with Dr. Goldstein with his brand new book that came out last time, But Seriously. We're going to talk about Future Method and all kinds of products, and you, of course, Bespoke Surgical here in New York City. I'm proctologist, the good doctor, the ass doctor. How are you?
I'm good. Thanks for having me, as always.
Absolutely. Good to see you. So I definitely can't wait to talk about all your new products that you're coming out on Future Method. It's really exciting. I'm staring at some right now, but I want to talk but seriously about some things. For starters, my co-host and I were talking about how in our 40s and 50s we've been going to the doctor more, and it seems like that age group, you start to get a little bit more serious about your health, men's health, and we were commiserating on, oh yeah, I saw my doctor for this, and all that. When it comes to our asses, how early should we, if we're bottoming, should we be seeing a proctologist and someone like yourself for checkups?
Yeah, I mean, I think, first of all, most people nowadays come through once a year if you're bottoming. I think a lot of people, the reality is I'm trying to change the culture that people should go to an anal surgeon or a proctologist specializing in sexual wellness even before they bottom. Because the issue is we see just lack of sexual education. So most people get into bottoming and they have terrible first experiences or create issues that then need specialized attention. But if we would just focus on more sexual education to make sure that people understand what type of asses do they have. Can they just take dick and go straight through it? Should they dilate? What are the things that need to be? And then by doing that, we kind of have a baseline of like what your hole is, and what your ramifications are. And then we start to kind of follow people once a year. But most people come through once a year. We do obviously STD screening, anal pap smears, which looks at HPV screening to prevent anal cancers, a thorough evaluation inside and out, checking the prostate, the muscles, hemorrhoids, fissures, any warts and all that stuff. And then we usually every couple of years measure anal pressures by doing what's called anal manometry, which tells me kind of the pressures anally so that if people are getting too loose, their sensations are less, or are they too tight because of issues and their bottoming is compromised. So there's lots that goes into that.
Yeah, so it's almost that theory that don't go when you have the problem, more preventative.
Yeah, and I think it's also, women are really brought up that the gynecologist is a standard.
Right.
And I think that realistically, that should be how we think of from an anal perspective, especially if it's all in our community and we're using it, routinely. The key is how do we make sure that we keep the longevity of it? Because that's the bread and butter. Sex is so important in everybody's lives.
Absolutely. That's what we talk about here. Well, you mentioned HPV,
Sure.
And I know you gave me the HPV vaccination a few years back. It was 2 doses?
Three doses.
Three
yep.
doses. And lately I've been seeing a lot of commercials about getting HPV vaccination. There was a story about linking HPV with heart issues later on in life. The commercial says that many of us have it and it goes away. Talk a little bit about, should we be getting that, and how does it show up?
Yeah, most people are getting it. The younger kids are getting it in high school into college now. So a lot of that is standard. Even for my 2 kids, my kids' pediatrician called and said, hey, do you want them to get the HPV vaccine? They're 13. And I was like, yes, of course. So I think most people that are, I say that most people that are engaging anally should get the HPV vaccine, even if it used to be only for women. Then it was men up to the age of 26. Then it went up to the age of 45, which it currently is now. And then that doesn't specify kind of gay sex. So
Right.
when you look at even in the gay sex arena, realistically, I think it's a huge added benefit. It's 3 doses. It's 1 shot, then in 3 months another, and then in 6 months another. It's only covered through insurance up to the age of 45. But I think if you're bottoming and you are available to get it, I think you should do it. The key is that most of us have HPV.
Right.
The issue is that we don't have all 9 types that are in there. Also, I see it a lot when people have HPV anal warts that I'm treating. One of the things that I do is I give them the HPV vaccine for people that didn't have it, and you see that it mitigates recurrence of warts. So you have to say that it must create an immune reaction, excuse me, for even if people are exposed to it, it must create a reaction that allows people to prevent recurrence or progression of HPV. So I'm a huge proponent of it.
Right.
You know, most people don't, especially the scientific community, doesn't study gay men
Right.
for the most part. And do the right analysis, because I bet you if we did the right analysis years ago, it would show that its benefits are prudent for everybody.
And that's why it's so good to see outside of your general practitioner who probably doesn't know a lot about prescribing. You know, maybe they can prescribe PrEP, but they don't know things like, you know, you've told me about Valtrex, which can be flare-ups that happen. And Valtrex is, tell us a little bit about that one.
Yeah, so, you know, Valtrex is the mainstay treatment for herpes. There's 2 types of herpes, herpes 1 and 2 that we know of. Herpes 1 in history has been oral herpes, which all of us have, and that's just from kissing and licking and doing all the
We
fun
learned about
things.
that when we were teenagers.
Totally.
And, oh, you have herpes, and what's that?
Totally.
Must be herpes on your mouth.
Exactly.
Yeah.
Exactly. And then what they classified as genital herpes, which is herpes type 2. I actually see herpes type 1 anally more than I see herpes type 2, because many people lick and suck and fuck, and we skin-to-skin contact, and we're going down there.
Right.
And there's an exposure. So most of herpes type 1 are these external ulcerations that are kind of painful and in that space. When it's herpes type 2, it's a rip-roaring fucking STD. I mean, it's like internal pain, pelvic pain, prostate. You'll know it. Now, for the listeners, I have seen so many people come to me with herpes type 2 infection after seeing their primary care doctors with anal pain, and they don't get herpes swabbed. I don't know why it's not standard. So whoever is listening, whenever you are getting chlamydia, gonorrhea swabs, you should be asking for herpes swabs too, because there's so many times that they are chlamydia, gonorrhea negative, and they're still in pain, and they're like, what the fuck is going on? And they come and see me, and I'm like, did they swab for herpes? They're like, no, and it's a rip-roaring herpes 2 infection. So I would say from a STD screening perspective, remember, we do the bloods mostly for syphilis. Then you're going to do oral swab for chlamydia, gonorrhea,
Right.
anal swab for chlamydia, gonorrhea, urine
Yep.
for chlamydia, gonorrhea. And I'm a huge proponent of adding on the swabs a herpes swab. I think it should be standard of care, because so many people come to me with terrible consequences of a prolonged herpes 2 outbreak, and they weren't treated by hospitals,
Properly.
by urgent cares, by practitioners. So just make sure that we're doing it.
Thank you for that. Yeah, I will add that in again with my general practitioner. I had to tell him to swab for the throat and the anal region,
anal stuff.
and he just wasn't going to do that. But he said no problem. But it's one of those things like educate yourself, and
Totally.
then you just have to tell your doctor.
Yeah, and what you were getting back to before with HPV and herpes is I see a lot of people come to me with anal warts from HPV, the virus, and we talk about the vaccine and all of that stuff. And sometimes I do surgery, sometimes I do creams, or sometimes I do both. Now, a lot of times when people get HPV, they're also getting HSV. So I see that it's an immune reaction, and there's no studies. I wish that I had time to do it and or the resources to do it. But when people come to me, a lot of times they're using wet wipes, or they have a herpes, they have a warts outbreak. And by putting them on Valtrex daily, it mitigates the warts from coming from HPV, and it also helps kind of create an immune reaction. So with that being said, if it's a run-of-the-mill, one-time, one-and-done anal wart thing, no big deal. But if you're seeing recurrent stuff and having issues, you may want to think about going on a daily Valtrex to prevent not only the herpes outbreak, but I see it counteract helping the HPV side.
Yeah, I mean, I can say for myself, I've had no flare-ups when I take the daily Valtrex, and it works well as opposed to when I haven't taken it. So
Totally.
Yeah, so that's really good. So I talked about on this show before that I had a fistula several years ago, and it was surgically removed. Can you one more time tell us what a fistula is? And I have a friend of mine that has a recurring fistula, and he keeps going back for surgery. I think he's on his 7th surgery.
Oh, wow.
Is that, I mean, obviously it's his case, but can that happen?
It can be quite complicated, fistulas. So fistulas are basically tunnels. There are these glands inside our asses, which is about 3 centimeters inside, and everybody has them. And especially in the anal space, for some reason, it's probably with douching, it's probably with sex, where the glands just get clogged. Now, all you straight boys that are listening, if there are any, that don't engage anally, it can happen too. I see it in men that don't engage anally and women as well. But a lot of it in the gay space is from STDs, douching, and what happens is literally shit, mucus, whatever gets into the gland and clogs the gland. And the gland is stupid. Instead of it shutting off, it doesn't. And so the fluid that normally would create mucus, which normally goes into the ass, normally starts to kind of go outside of where it's supposed to be. And then people develop a huge abscess or a big pimple in that space. And then it's super fucking painful. Most of the time it either drains itself or a surgeon or a doctor needs to drain it. Then once that has kind of healed somewhat, a lot of people develop into what's called an anal fistula, which is a connection between the gland inside and the pimple that developed on the outside. And it's basically like a tunnel that develops. Wow. So that needs to be surgically treated. And I usually break it up into simple versus complex. Simple being, is there any muscle in that area?
Right.
Because there's a lot of muscle, and you can't cut all those muscles. Now, the good thing is that most men, people born with prostates, have a lot of muscle in that space. So depending upon which muscle it goes through, you can cut it without a consequence.
Because there's so much extra there. Yeah.
Exactly. But your friend probably went through a very complicated course where many people try to do many different surgeries to fix that. Those surgeries are like a toss in the coin of whether it works or not. And I see a lot of the proctologists that are out there just don't understand the gay anal space. So they don't understand the consequences of either cutting it or the way that they're approaching it. Yeah. A lot of them do this surgery, which is called an advancement flap, which is basically moving tissue over the hole on the inside. And then I find that it fails, and then you're left with huge holes and drainages and then multiple fucking surgeries. So it gets super complicated. Yeah. It gets very complicated. But I'm more than happy, even if he doesn't want to see me, to just have a conversation to kind of walk through, because I've been doing this for a while, and because there's so many people in the world that have these issues, a lot of people come with very complicated stuff because they've been to the run-of-the-mill proctologist that knows nothing about anal sex, gay sex, and consequences like this, where we need to start thinking kind of outside the box and get these people back into a great space so that they're shitting without issues, you're not draining, you feel sexy, and then back into bottoming.
One question about working out.
Yeah.
When we're doing things that we've talked about it before, but when we're doing squats, many of us clench.
Yeah.
I don't anymore. I've relaxed. Can that lead to issues with our bums if we're tightening too hard when we're working out and that kind of gritting the teeth feel, but you're doing it with your ass?
Yeah, I mean, I think, yes, it can in many different capacities, and we'll go through all of it. It really depends. That was where coming to see me once a year or someone like me that's doing all these tests, you can understand like what we should be doing. Like someone that's into bigger toys and fisting, I need them to do a lot of contraction.
Right.
So sometimes I even tell people to put a small glass toy in and squeeze on the toy and do Kegels and do work. Sometimes we have people in the office where they're sitting on a chair that does 12,000 Kegels in 28 minutes because it really contracts not only the muscles that we're doing at the gym, but also the anal muscles higher up. So it really depends. Now, for someone that is limited anally, where they're too tight or they're having difficulty with entry from an anal sex perspective, you can imagine going to the gym and doing squats and pulling in and squeezing. You're just building more and more muscle and making things tighter. So I see a lot of people that are bike riders, Peloton, people that are doing long distance bike rides. And what happens is a lot of them suffer from pelvic floor issues, whether it's the pelvis is way too tight, whether the prostate gets irritated because of all of the tension in that space. I see a lot of Broadway dancers, ballet dancers that all love to use the pelvis, which is so important. But what happens is it hinders shitting and sex. Wow. So I think it really depends on what type of hole you have. Yeah. But think of going to the gym and squats as like most people are doing squats to build their quads and their cheeks, right? Their glutes, not necessarily your pelvic floor. So that's why I say to you, when you're doing squats, try to really isolate the cheeks, the glutes, and the core, not so much your asshole. And you can do that through practice, like using a toy and trying to do a squat with a toy kind of in so that you're like, okay, how do I squeeze? Because you can learn how to do it.
Yeah, break it down.
Exactly,
separate.
and really isolate those muscles. Now, if someone is into big squat days and they're really in a tight spot, I would say it's fine. Just like that night when you come home or the next day, do dilating using toys and stretch. Because one day we're doing bicep, the next day we're doing tricep to stretch the bicep. But we never stretch our asses unless you're bottoming and engaging regularly, which is awesome. And if you're doing that, that's fucking great. Yeah. But most people aren't. And so the issue is, how do you learn the muscles in the pelvis and isolate them and be able to control them? Because it's like sometimes when you're sitting at the desk and you realize that you're not sitting up straight, you pull your
shoulders back, yes.
Shoulders back. It's the same concept. How do you kind of understand when you're clenching and be able to relax? Especially as we're aging, the prostate becomes a finicky fucking thing through many ways, and so that can help mitigate some of the consequences.
I love it. Good advice. And then in terms of like sex, when you see those videos out there where they're pushing their ass out, there's a lot of videos out there where that's a whole thing. Are we doing damage to our holes when you really push it out like that?
Yes.
Okay. I thought so. Yeah.
I mean, I think the reality is that the push-out technique, I think, is quite good on initial entry. Yeah. So what people are doing, so remember there's 3 muscles in the ass. The internal sphincter, which is really thick, that's the one that you and I can't really control. If the listeners are squeezing their holes right now, squeeze your ass, you're squeezing 2 out of the 3. So the first 2 you're squeezing. The third one is the one that you and I can't control. That's what happens when you push out. You're actually activating that third muscle to learn to relax. And it's a reflex. And it's the same thing. Normally, a piece of shit does it, meaning the poop moves. It tickles that third muscle. You feel like that you have to shit. So it relaxes, and then you relax the other two to make a poop. But when you are, from a sex perspective, many people initiating sex do that. I think that that's a great technique, and you can try to do it with toys, and we talk about it with Future Method and the glass toys of like, as the toy is going in, pushing out to engage the pelvic floor muscles. But it should be only during entry. Now, I'll support anybody, and a lot of people love the rosebud pushing out technique. The problem is that it's a very short window of, one, good functionality, and two, how it looks. Because the more you're pushing out, the more hemorrhoids develop, the more stretching of the skin.
It's not really meant to be, it's not to come out of its shell like,
exactly,
like you are pushing it
so
out.
I get it, and if it's your kink and you love it and you want to do it, great. Then you should be coming at least once a year so that we can monitor the pressures. Do you need to be on the chair? Do we need to do certain things to keep you in that? It looks great, it functions great, and it's not a fucked up situation.
Yeah.
That's where I think the key is. How do you, and again, it's the same thing we were talking about with squats. Like, how do you go to one extreme on one side, but then bring it back? So how do you, in those people that are doing pushing and really opening up and bigger stuff, how do you work with contraction and pulling in so that you're fine tuning it? And I think that that's the difference with what we do at Bespoke, which is like, how do you really understand just sex? And I think that that's the thing that people don't really understand. All these practitioners that are out there and all these clinics, it's great. They're general. They do a lot of really good things. But the reality is sex is like so specific. And when you see 90 people a week with sexual related issues, you start to really understand a lot further what really needs to be done to keep people where they want to be.
Yeah, and it's really, sex is so sacred and we love it and we want to keep doing it. We should treat it like we treat our bodies. You rest, you have days of rest because you can't work out you can work out every day, but as you get older, you need to stretch. And if we took our asses and our genital areas as seriously as we did our bodies, we'd probably be in a lot. And that's what you're trying to do, I think. The science of sex, understanding of it.
And I think, look, we love to party.
Right.
We love to have sex. Yeah. And a lot of the parties and the sex are quite extreme.
Yeah.
And it's a lot. And the reality is that, it's all well and good that you can take 40 loads, but at the end of that, it's fucking tough. Your whole, how long can that sustain?
Correctly.
It's very traumatic.
Takes a toll.
Exactly. And so the issue is, where do you want to go sexually? And then how do we all understand the risks and the benefits of that? And then really just reevaluate all of that so that are you in a good space? How do we keep you in a good space? And how do we make sure that moving forward that your ass is open for business? That's
all what we're looking for. Taking a quick break from the Dr. Goldstein interview. Isn't he awesome? Reminding you to head over to our Tags Patreon community. Grab a free tier where you get behind the scenes coverage that you will only get on our Tags Patreon community. But while you're there, consider grabbing a tier. And while you do, know that you are supporting the show you've known to come and love. You can also buy individual posts too. So if you're a free member, maybe you want to get commercial free once in a while. Or maybe you want to get our bonus episodes, which you can do alongside your free account. It all happens over at patreon.com/tags podcast. That's Patreon.
This episode is brought to you by Progressive Insurance. Fiscally responsible, financial geniuses, monetary magicians. These are things people say about drivers who switch their car insurance to Progressive and save hundreds. Because Progressive offers discounts for paying in full, owning a home, and more. Plus, you can count on their great customer service to help you when you need it, so your dollar goes a long way. Visit Progressive.com to see if you could save on car insurance. Progressive Casualty Insurance Company and Affiliates. Potential savings will vary. Not available in all states or situations.
patreon.com/tags podcast. Okay. And then the ever question about Doxypep.
Yeah.
And it's a great drug that can help mitigate or keep away STIs, STDs. But there's always confusion. I was talking to you recently about how to take it, when to take it. And what's your recommendation on Doxypep? And are you a big fan of it?
Yeah, I mean, I've been doing Doxypep for a long time before it became crazy vogue.
Right.
And now it's totally
Yeah, right.
vogue, which is great. We definitely see a mitigation of risk of STDs. It's definitely working. The issue is, what are the long-term ramifications? And it doesn't look like from a super bug component. I think it's more of, the microbiome and the internal components and what are some of the consequences of that. And that's being studied.
Okay.
But what we do know now is, the studies show that Doxypep, so it's 200 milligrams. Most of the time we have 100 milligram tablets. So you take 2 of them within 72 hours of your higher risk hookup. The issue is, in our community, it's like, all right, well, first of all, how do you define what a high risk is?
Right.
Because who the fuck knows?
Exactly.
Even the one person that's like, I never sleep with anybody, well, they may have something.
Yeah.
So that may be high risk, right? The other is, if I'm fucking Friday, Saturday, and Sunday, well, what do I take it Saturday, Sunday, and Monday?
Exactly.
Or all that type of stuff. So it can be quite confusing. I usually tell people kind of lump your sex, meaning, let's say you're getting fucked Friday night, Saturday night, then take it Sunday or Monday. I'm someone that's like, take it once a week if you're having that much sex. Look, obviously, if you go into a crazy sex party and you're like, what the fuck is happening? Then you can take it. I mean, take it in those situations. But I think if we kind of look at it like, most people, I don't know, Mondays are not like a great sex day.
Yeah, right.
People like right?
Yeah.
So where you just say, okay, I've had a lot of sex over the weekend. I'll take it on Monday to mitigate that risk. We know that it works really well with chlamydia and syphilis. It's 70 to 80% some of the data. It's probably about 30 to 50%, if that, on gonorrhea. So we just got to make sure that we are making sure that you're still getting checked and treated and evaluated and all that type of stuff. But it really has been super helpful. And that kind of probably segs us way into douching, because I think the realistic picture is that why are STD risks so high? One is obviously just people don't get tested. That's what helped with PrEP, right? Is the management with PrEP is that you have to, in order to get PrEP, get STI tested. So you get to catch so many people that wouldn't necessarily know because it's asymptomatic. That's where I think it's so important. Even these telemedicine doc places, it's so important to make sure that you're not just doing bloods and that you are doing swabs, because there's so many times that I see positive on the swab and negative on the blood. And you wouldn't have known that if you're not doing the swabs. And should you be doing your own self-swabs? Well, I think the realistic picture is, if I was doing my own self-swabs, I would go to first a practitioner to show you how deep you need to go and how appropriate swabs should be, because so many people are so reticent of sticking the fucking thing up your ass.
They don't go deep enough.
You don't go deep enough and catch what the issue is. So, there's lots that goes with it.
Didn't even think of that. Yeah.
Yeah. There's so many times that people come to me, they're like, oh, I self-swabbed and there's a nice STD, and they just didn't go far enough to get where they needed to be. But I think that Doxypep really came about because it's like, well, what else can we do to mitigate these risks? And, when we look at douching, that was the impetus of me starting Future Method, which was like, wait a second, we know people are going to douche, even if I tell them not to. How do we douche with a solution that's not toxic? Well, what is toxic? Water. I know people think it's clean and it's healthy and you drink it in drinkable countries, but the reality is that it's what's called hypotonic or hypoosmolar. And what that does is it fucks with the internal cells. So most people overdouche. They're using shower hoses. They're doing lots of douching. And what happens is it basically washes away the internal lining of your appropriate bacteria. There's good bacteria, there's bad bacteria, but they're in equilibrium. Right. When you start rinsing, when you're using water-based lubes, when you're doing this, what happens is you start to fuck with the microbiome. And there is an overgrowth of bacteria called Prevotella. And so that's why I always say, like, we can go on the street on 7th Avenue here and swab 10 people, and I'll know who takes it up the ass just because of their bacteria count.
Wow.
And that bacteria is what probably predisposes people to higher risks of anal issues, of STDs and injuries. So what happens is that now you're having unprotected sex, which most of us are, and then someone has an STD, your internal lining is raw and kind of exposed. You wouldn't know it because you don't feel that. And then, boom, the inoculation happens in the STD. So that's where Doxypep comes into play, because it probably kind of helps with the transmission of that. So you're raw, but you're taking the Doxypep, which now makes that transmission of that STD lower. Right, yeah. Exactly. So the issue is it's kind of putting a Band-Aid on the situation, right? So obviously now it's like, hey, how do we do that? But like, well, what are the ramifications of all of those things? Because the microbiome is still fucked up. Now we're using lots of antibiotics. What are some of the consequences of that? So with Future Method, I was like, well, let's just first start like looking back and be like, okay, well, why can't we just come up with a douche solution that's not toxic, that doesn't fuck with the microbiome? That would be gentle. That's right. That would be gentle. And so from water to enemas, they're both on the opposite spectrums where it messes up this issue. So we came up with a solution, and the solution was a powdered pack that's basically like Crystal Light that you put it in every 4 ounces of water. And what it does is it neutralizes it. And there's a special range of where you want it to be. Same thing with lubes, and it's very difficult to get there. With our brand, with Future Method, the powder packs are in that range. So it cleans you, it keeps you silky, it keeps you sexy, but it doesn't fuck with the microbiome. And a lot of it was also like, how do you just think differently? Like gut health first before butt health. And like, how do you eat correctly? How do you use fiber and pre and probiotics? We're the first ever pre and probiotic that replenishes that anal microbiome. So even though we're douching and we're doing pre and probiotics just innately through sex, spit, lube, oils, whatever everybody's using, your microbiome in that space gets altered. And so the key is, how do we replenish the microbiome and then also do techniques that don't fuck with it? And our recent launch, which just launched, are these pouches that now have an appropriate kind of enema-style tip for it. So it's like super easy so that it's on the go. You don't have to bring your bulbs. You're able to just fill it with water and then our powder pack, and then literally from the actual pouch itself deliver the douche so that you're able to clean out.
So easy to just take with you on the go and put it in your backpack and go. And if you find yourself in that situation, they're really easy. I'm staring at them right now. I love the idea now of just the powder versus being filled already. I think the originals had liquid in them originally.
Yeah, I think the liquids, it's just expensive to ship liquid. And it's just like, we're trying to bring as much cost as we possibly can, especially with all the tariffs and all these current situations, right? But one is not shipping liquid. And two is it's obviously easier from a travel perspective. Also, most liquids have preservatives. And you can see every year that we live on in life, many of these preservatives are on these lists, right? Where it's just like, how do we beware? So a lot of it is like, when you have a powdered solution, doesn't need any of those preservatives, where we are now able to just make sure we mitigate as much risk as possible. So it's super cool to be kind of on this forefront of bringing kind of science into sex, especially into kind of anal and gay sex, because, when you see 90 people a week and do 10 to 15 surgeries a week, you really start to analyze sexual patterns. And then you're able to kind of basically A/B test in that space where you're like, well, wait a second, how do we just look at that risk and then try to mitigate it as much as possible? We're never going to be able to get down to zero with anything, but the sexual habits of how people prepare for sex, how do they engage sexually, what do they do as aftercare, and then how do we bring all of that education, just like we did with Butt Seriously and what we're doing in the space and what you're doing, is to really look at risk and look at sex in a positive light and figure out how we can have the best possible sex for the longest possible time with the least amount of consequences.
I love it. Sustainability. Absolutely. We have to talk about your future method, new lubricant, silicone. I know you're a big fan of silicone for us to use. Water, you say, is not the greatest for our asses. Talk to us about why silicone and this new lube.
Yeah, I think silicone lube for anal is still the best. When you look at lubricity and all the tests, I find that water gets sticky. Water has glycerin in it, the water-based lubes, and glycerin is what fucks with the microbiome. So it's not that we won't go into the water-based space. It's just it really needs to be done correctly, because the reality is like, great, you're using a Future Method douche powder pack, but like, well, then you're going into a water-based lube that's just fucking with you more. And so it's like, how do we kind of understand the right ways? First off, from a lubricity and opening you up and staying in the right location, silicone lube is the best. If you're into water, popping into the shower and having shower sex, silicone lube is still evident and works. We came up with a button body scrub because a lot of people have excrement and whatever and lube and all that stuff, and it's difficult to get off, especially the silicone lube. And that was where we were like, all right, well, let's just do a beaded formulation that makes it much easier so that you're able to do silicone. Silicone also works really well with our glass toys. I think that, a lot of people use our toys to pre-dilate, to pre-lubricate, also to get into good sex and learn their asses. And we want to set the stage for success. So it's like, if you're using the right tools to learn to bottom, you should also be using the right lubes, because it'll just allow for it to stay where it needs to be. A lot of the water-based lubes not only mess with the microbiome, they get absorbed into the silicone toys if you're doing it, or over time it gets sticky and kind of clumpy and you have to reapply. And it also really just mucks with the local thing. So I think the key our first was like, all right, let's just go into what we know, which is silicone-based lube, and push that. And then work backwards to say, okay, can we bridge it with like a hybrid or something approach, and then what's the right water-based lubes? Because the best water-based lubes don't really have glycerin, but the problem is that then it sucks because you need glycerin to make the lube. So
what we all like about
exactly. So it becomes a catch-22. So it's not an easy feat.
Yes, exactly. And we have to talk about the silicone anal cone that you came out with. I love the design. Again, silicone. You're a big fan of them, as well as glass.
Yeah.
Talk to me about this particular one that's out.
Yeah, so what I was seeing in the office was that a lot of people were coming to me where they were able to use the glass toys and dilate and relax the muscles, but they were getting kind of these little cuts or fissures or tears in the skin. And so you start to think of sex like, how do we get the ass to open? Well, the ass is not complicated. It's muscle, and we spoke about those 3 muscles, and it's skin. So if the muscles are able to relax and they're able to open, then why would someone tear? Well, they would tear if their skin is either fragile,
right,
it can't take the pressures of sex, or it just reaches its limit where it can only open a certain amount, but it needs to open more for your partner or the bigger toy or the DP or the fists, right? So it all depends on what your limitations are. So what I said was, okay, well, if the glass toys are dilating people and understanding their pelvic floor to get relaxation, can't we come up with something that is going to stretch the skin directly? And if you think of a cone, the skin is always going to be open the most when you're using the cone. So what it's doing is it's basically opening the skin very gradually. And that is going to give you more room. I always use like the pizza pie analogy, which is most people need 8 slices of pizza for their ass, but they only have 7. So what happens is it tears, or a hemorrhoid develops, or extra skin because it doesn't open. So the issue is, how can we get it to open more? Anal Botox, which we do a lot for the muscle side of things. I do a little bit of the Botox also in the skin to give some relaxation, but a lot of it is with toys. And so by using a cone, gradually what you're doing is you're basically building that 8th slice. Sometimes I need to do it surgically, where I need to give people more room, especially if you're scarred or you had surgeries before where they're limiting you as it relates to it. But it's a lot of work to get people to understand the intricacies of the skin and the muscle. And then that was where these toys came about, where it was like, okay, how do we just kind of make it simple and easy so that if people are practicing with glass and the cone, now they're really, the apparatus that's there is optimized, and it's super interesting. One other thing that we've been working with in the office is this thing called temperature, because people's skin is so thin. You know, a lot of people come to me where it's just like paper mache. And so anytime anyone does anything, it tears. So the toys are really great because it creates friction and it tells the skin to get tougher.
And practices before you actually meet your partner.
Exactly.
Yeah.
And then I was like, well, can't we just do something locally? And we worked with a really great company, and there's a device called a temperature, which is basically radio frequency ablation, non-invasive. It's basically heating up the anal cavity from the outside skin to the inside. And it's multiple treatments. It's usually about 3 to 4 treatments depending upon the severity. But what it does is it stimulates the collagen growth in that space. So it tells the skin and the underlying skin to get tougher. So a lot of people were coming to me with these micro tears where I didn't need to do surgery on them, or why would I go to that degree, but yet they're still not able to have great sex. And so by doing this, using the toys plus a temperature, what we're doing is we're telling the skin, get tougher, get more pliable, and it fucking works.
Wow.
I mean, it's been amazing because the key again is when you start to see these problems, you have to figure out solutions. And a lot of it is not only surgery. You know, a lot of times I don't want to take people to the operating room. And what can we do non-invasive first to try to get into a better space? Because once I do surgery, it opens up a whole nother can of issues.
Yeah, right.
And like we want to limit that. And so the key
That
is
should be the last resort.
Exactly. And
Yeah.
I break things up always into kind of 3 buckets. How do you do things on your own? Through either, you know, our toys, through Butt Seriously, through your own understanding of your anatomy. How do you kind of dilate and stretch and get into a good sex routine? That's bucket 1. Bucket 2 is, do you need me in the office, like anal Botox, physical therapy? Do we need the temperature or other components to help? We do a lot with scar work, with microneedling and revisions and all of these other components. Or do I need a 3rd bucket, which is surgery, because there's something that has to first be fixed before we go back to bucket 1 and bucket 2.
I love it. Great stuff. Well, people can go to futuremethod.com. You have so many, and it's all like really thought out science toys. And back to the anal douche kit really quickly. How, once you get these, you basically just get the
it's
kit,
a single-use kit.
I love it.
They come as 2 packs, 5 packs, 10 and 20. And then, you know, the key here is to see how people are engaging with it and utilizing it, and then kind of figure out from there the best ways to approach it. But it's usually a single use, where you'll use like a pouch for each session that you're doing from a sex perspective. Obviously, the goal is to douche less. I want people to douche less, even though I'm partnered into a douche company. The reality is, how do you use fiber and pre and probiotics and use toys not douching so that you're able to see that you're clean? And if you are douching 4 or 5 times, how can you titrate down? Because a lot of people are initiating bowel movements by doing that instead of just cleaning where run-of-the-mill sex and dick would go. So I think a lot of it is learning your own body. A lot of people do the toy stuff without douching so that you're able to see that most of the time you're actually going to be clean. And so the key is to titrate down. So if you're doing our pouches, how do you do kind of 1 to 2 rinses and feel comfortable with it? If you need more, fine, do more, but see over time if you could work other ways, because the key
gut
is
health and
gut first before butt. Because if
I
you're
like
doing
that.
the more butt that you're doing from a douching and a preparation, you're kind of setting the stage for injury, because you're before you even have sex, you're fucking with that area too much. And sometimes you just have to say, today's not the day.
Yeah,
You know, like
exactly.
be confident in yourself to just be like, okay, you know what? Like, I'm not going to risk it, because the consequences of having issues develop is it can be quite, you know, an issue and catastrophic.
Excellent advice, and you can always read more about it in your book, But Seriously, which is out too. You can get it on futuremethod.com as well. People can go to bespokesurgical.com to find out more about you here in New York in your office. And can they follow you anywhere else?
Yeah, for sure. So me, my life, crazy kids, and my partner. And if y'all have partners, fuck. So it's Dr. Evan Goldstein. So Dr. Evan Goldstein on Instagram. And then the brands are Bespoke Surgical on all socials, as well as it's The Future Method on Instagram. So yeah, and it's super cool to be in this space. I thank you for what you do, because the narratives and pushing out to the masses is the key to make sure that people have the education and the understanding, and if something goes wrong, a place that they know that they can have their back, literally.
Thank you, Dr. Goldstein.
Thank
Excellent,
you.
as always.
I appreciate it.
Absolutely. Thanks again to Dr. Goldstein. Love it when he's on. We will have him back for sure. You can follow me on the gram. I am _Steve V. Go to my Blue Sky account at Tags Podcast. Go to tagspodcast.com. Subscribe to our newsletter, which comes out weekly. And don't forget to head over to our Tags Patreon community, patreon.com/Tags Podcast. And in the meantime, continue having hot, gay sex.